If you've been diagnosed with depression, here's the first thing you need to know. Depression can be effectively treated. Today, there are many proven options to manage depression symptoms. It's equally important to know that treatment isn't an overnight fix. I tell my patients to think of recovering from depression as a marathon, not a sprint. Since depression impacts every individual differently, patients must often try more than one medication before finding the right one. The same is true for psychotherapy. A patient may need to experience more than one approach before finding the right fit. And regrettably, a subset of patients, no matter how many of these strategies are tried, depression symptoms still don't respond. Those patients suffer from a form of the illness referred to as treatment-resistant depression. If you've tried several different combinations of medication and psychotherapy and you're still suffering, your depression may be treatment-resistant. If that's the case, it's understandable to feel frustrated. But as a doctor who specializes in treatment-resistant cases, I'm here to tell you, you're not out of options. Don't give up hope. Today, patients who have not responded to conventional therapies are incorporating alternative approaches into their treatment plans, and the results are very encouraging. Top institutions like the University of Michigan Health System can offer patients a category of treatment called neuromodulation that uses electrical currents to stimulate or modulate the brain's function. These therapies include electroconvulsive therapy, repetitive transcranial magnetic stimulation, and vagus nerve stimulation. Each of these options takes a different approach, and each has its own risks and benefits, but all have been shown to safely and effectively alleviate the symptoms of depression when other therapies fall short. When we sit down with patients and families to discuss neuromodulation therapies, the first thing we have to do is dispel some very common and disturbing myths about using electricity to treat the brain. Many people associate this approach with something out of a scary movie. Nothing could be further from the truth. Today's neuromodulation techniques are performed by highly trained specialists who ensure the safety and comfort of patients. And improvements in these therapies have made them more effective, and their side effects less severe and less common than ever before. We advise patients and families to do their homework and thoroughly discuss the benefits and risks with a healthcare professional before embarking on any treatment strategy. Our websites, depressioncenter.org and depressiontoolkit.org, are good places to find out more specifics about treatment-resistant depression and the various neuromodulation therapies currently being used to treat it. Remember, depression is a real illness, and there are many effective tools available to manage it. For the millions of people facing a diagnosis of depression, today's treatment options are offering more help and more hope than ever before.